Hey there, have you heard about the incredible benefits of aspirin? And what about the risks that most people have no idea about? What if I told you that this tiny pill music can be your best ally and at the same time dangerous if used the wrong way? I'm a cardiologist and I prescribe aspirin almost every single day. But here's what most people don't realize. I also tell patients to stop taking it almost as often. In this video, I'll show you exactly how aspirin works, its real benefits, and the risks nobody talks about, and how I personally decide who should take it. If you or anyone in music, your family takes aspirin, whether it's baby aspirin, low-dose aspirin, music, or regular aspirin, you need to watch this until the end. But first, hit the like button, subscribe to the channel, and share this with your friends and family, because when it comes music to your health, it's worth sharing. Now, tell me in the comments, do you take? Are you allergic to it? And where in the world are you music watching from? Write down below. Let's dive in. What is the aspirin paradox? Think about this. In one tiny pill, you have a painkiller, a heart attack pretor, a stroke pretor, and possibly even a cancer pretor, all in one single tablet. So here's snorts, the 1 million question. Should you be taking aspirin? Yes or no? This is one of the most important questions in medicine today. Aspirin, or acetylsalicylic acid, is one of the best-selling medications in the world, but it has real risks and real benefits. Is it for everyone? Absolutely not. But without a doubt, it's one of the most important medications ever created. You know who invented aspirin? This guy, Felix Hoffmann, a chemist at Bayer in 1897. He developed it to relieve his father's rheumatism pain. But here's the thing. Humans have been using its natural equivalent for thousands of years. The word aspirin comes from spire, a type of shrub that contains the key ingredient salicylic acid. You can find similar compounds in willow bark, jasmine, beans, peas, and certain grasses. The ancient Egyptians used willow bark for pain and fever. Hippocrates, the Greek physician, wrote about it around music 400 BC. But it wasn't until 1899 that Bayer distributed aspirin as a powder. And by 1915, it became an over-the-counter tablet. Now, let me show you exactly how this works in your body, how aspirin works. Do you know? First, aspirin is an antiplatelet agent. Here's what that means. Aspirin helps prevent heart attacks and strokes by stopping blood clots from forming inside your arteries. Picture this. You have a fatty plague inside your artery. If that plague ruptures, it can trigger a clot that blocks blood flow completely. That's a heart attack if it happens music in the coronaries or if it happens in your brain, a stroke. Aspirin prevents platelets, those music tiny cells in your blood, from clumping together and forming music, this dangerous clots. It does this by blocking an enzyme called sialooxygenase, or COX. This enzyme is essential for producing trypsin, a substance that makes platelets stick together. No tremoxan, no clumping, no clot. Let me give you a real example from my practice. A 62-year-old man came to see me last month. He'd been taking aspirin on his own for 5 years. No doctor ever told him to. He just thought he was protecting himself, snorts, just in case. But when I ran his tests, he had no significant plague. No history of heart attack, no stents, nothing. And here's what he didn't know. He was bleeding internally slowly. His hemoglobin was dangerously low. He was anemic, feeling tired all the time, and had no idea that aspirin was causing it. That's the hidden risk nobody talks about. This is why I never prescribe aspirin just in case. There has to be a good and real reason. Now, aspirin isn't just an antiplatelet. It's also a powerful anti-inflammatory. It relieves pain and inflammation throughout your body, headaches, muscle pain, joint pain. It works by blocking that same COX enzyme, but this time reducing the production of prostaglandins, the molecules that cause pain and inflammation. This is why aspirin has been used for over a century for everything from headaches to arthritis. Let's talk about the proven benefits. The reason you are here. Number 1, prevention of heart attacks and strokes. This is the big one. Aspirin is fundamental for preventing heart attacks and strokes in people who've already had these events or who are at high risk. The usual preventive dose is 81 to 100 milligrams per day, depending on your doctor's recommendation. Number 2, potential cancer risk reduction. Here's something fascinating. Some studies suggest aspirin may reduce the risk of certain cancers, especially colon and rectal cancer. The theory is that aspirin triggers programmed cell death called apoptosis in cancer cells. However, these benefits require years of continuous use, and are not yet conclusive. We need to research more. Number 3. Pain and inflammation control. Aspirin is widely used for headaches, muscle pain, joint pain, and chronic inflammation conditions like rheumatoid arthritis. Number 4. Cardiovascular protection in diabetics. Diabetic patients are at much higher risk of cardiovascular events. Aspirin can help reduce this risk by preventing clot formation. It's a crucial part for primary prevention for these patients. Number 5. Preeclampsia prevention. For pregnant women at high risk of preeclampsia, low-dose aspirin can help prevent this dangerous condition and improve outcomes for both mother and baby. Any pregnant woman watching this information could be vital for you. Number 6. Improve survival after heart attack. For patients who already had a heart attack, aspirin significantly improves survival by reducing the chance of a second cardiac event. It's an essential part of post-heart attack treatment. Number 7. Liver fat reduction. Here's something new. A 2024 study published in JAMA looked at adults with non-alcoholic fatty liver disease. 80 patients were randomized to receive either low-dose aspirin or placebo for 6 months. The results, those taking aspirin had an average 6.6% reduction in liver fat compared to a 3.6% increase in the placebo group. Aspirin also improved markers of liver health and was safe and well tolerated. This suggests aspirin could be a low-cost option to prevent fatty liver from progressing to cirrhosis or liver cancer. Now let me tell you about the opposite case. A 8-year-old diabetic patient decided to stop his aspirin before a dental procedure without asking me first. He thought it's just a blood thinner. I can pause it for a few days. No big deal. 3 days later, he had a heart attack. What he didn't understand is that aspirin was the only thing standing between him and a clot forming on his plank. The moment he stopped, his platelets became sticky again. A clot formed, and he nearly died. This is why I never let my high-risk patients stop the aspirin without a clear plan and medical supervision. If your doctor put you on aspirin, don't stop it on your own, ever. But it's not all roses. Aspirin has real side effects. Increased risk of bleeding. Aspirin can increase the risk of bleeding, especially in the stomach and intestines. In rare cases, it can cause bleeding in the brain. This is why you should never self-medicate. Always follow medical guidance. Number 2. Kidney damage. Prolonged use of aspirin at high doses. High doses can cause snorts, serious kidney damage. It's crucial to respect recommended doses and avoid overuse. Number 3. Drug interactions. Aspirin can interact with other medications, increasing the risk of side effects. For example, mixing aspirin with medications for erectile dysfunction like sildenafil or tadalafil can cause a dangerous drop in blood pressure. Number 4. Allergic reactions. Some people are allergic to aspirin, experiencing symptoms like hives, swelling, and difficulty breathing. In severe cases, anaphylaxis can occur, a potentially fatal allergic reaction. Number 5. Reye's syndrome in children. Aspirin should not be given to children and teenagers snorts with fever, especially if there is a suspected viral music infection. This is due to the risk of Reye's syndrome, a rare but serious condition that causes swelling in the liver and the brain. So, how do I actually decide who gets aspirin in my practice after more than 20 years as a cardiologist? I use 3 criteria. Criterion number 1. Have you already had an event? A heart attack? A stroke? Do you have stent? Have you had bypass surgery? Do you have significant artery music disease? If yes, you are taking aspirin. Period. This is non-negotiable. This is what we call secondary prevention. The evidence is crystal clear. Criterion number 2. What does your calcium score show? If your coronary calcium score is above 300, or you have plaques blocking more than 50% of an artery, I seriously consider aspirin. Even if you've never had any symptoms, this is the gray zone where the decisions gets more nuanced. Criterion number 3. Are you diabetic with multiple risk factors? You have diabetes plus high blood pressure, smoking, strong family history of heart disease, then the math changes. The benefit of aspirin starts to outweigh the bleeding risk. The flip side, if you don't fit any of these 3 criteria, you've never had a heart attack, never had a stroke, don't have significant plague, and don't have major risk factors, I probably won't prescribe aspirin. And if you're taking it on your own, just in prevention, I might tell you to stop. The US Preventive Service Task Force has been restricting aspirin recommendations more and more for general population. Here are my practical tips for safe aspirin use. Follow medical guidance. Never use aspirin without a doctor's recommendation. Each case must be evaluated individually to balance benefits and risk. Number 2. Avoid self-medication. Don't mix aspirin with all other medications without medical guidance. This includes antidates and corticosteroids, which can increase bleeding risk. Number 3. Use gastric protection. If your doctor prescribes aspirin, he may also recommend a gastric protector like omeprazole to protect your stomach and reduce the ulcer risk. Number 4. Know your drug interactions. Always tell your doctor about every medication you're taking to avoid dangerous interaction. After more than 20 years of prescribing aspirin, here's what I want you to remember. This tiny pill can save your life or slowly harm you. It all depends on whether you are the right person to take it. Don't guess. Don't copy what your neighbor is doing. Don't take it just in case. Get tested. Know your numbers. Know your risk. And always talk to your doctor before starting or stopping aspirin. Did you find this video helpful? Hit the like button, share it with your friends and family, and subscribe to the channel for more health tips. Comment below if you notice other signs yourself or a family member when taking aspirin. And which music video should you watch next? I have 2 recommendations for you. My video on how to lose belly fat and my video about what to do if you are having a heart attack alone. My name is Dr. Andre Wombe. I'm a cardiologist, and this is Dr. Dre Health Tips. Remember to subscribe, and I'll see you in the next video. Thank you so much.